Good day, everyone. Thank you so much for taking time out of your busy day today to listen to today's webinar presentation titled Youth Firesetting, an Advanced Review with Implications for Criminal Justice, Forensic Mental Health, Human Service, and Legal Professionals. I am your presenter for today's webinar presentation. My name is Jerrod Brown. If you are wondering a little bit more about what we will be covering during today's webinar presentation, here is a brief overview training description. We have four main key training objectives that we're going to be covering today. The first one, we're going to really take a broad spectrum look at key research findings, statistics, and concepts associated with youth fire setting. We're also going to have an in-depth discussion about screening and intervention options that are utilized to help identify youth who are at risk to set fires. We also have a discussion that's going to focus on best practices, interventions, strategies, tips, solutions on how to help youth just avoid these kind of behaviors. And we're going to be covering a whole bunch of other just indirect and related topics. So I estimate today's webinar presentation is going to probably be somewhere in the ballpark of 120 minutes, so we're going to be covering a great deal of information in a short amount of time. If you're interested in learning more about my professional background, here's a brief overview of my bio. If you have any questions related to today's webinar presentation after the fact, please do not hesitate to send me an email at the email address listed below on this slide at jerrod01234brown@live.com. So as we start digging into this complex and very important topic, there are many definitions out there about youth fire setting. What you'll realize from the research literature is that most of the authors identify it as a complex topic. Needless to say, there are many variables that are at play when a youth sets fires. It's typically not just one reason. So the factors are usually influenced by a host of variables. And these can be internal variables, external variables, societal variables, and we'll dig into those throughout today's presentation as well. A big takeaway point that I'm hoping all of you get from today's webinar presentation too is really learning about what factors cause or contribute to fire setting behaviors, because if we can identify those early on, intervention can be put into place and hopefully help these individuals not engage in these kind of behaviors going forward. But I think it's also important for us to have a discussion about what factors maintain or support fire setting behavior where it becomes problematic and repeated over time. Again, needless to say, this is, again, a complex issue. It's a serious issue. It's a dangerous issue. It's a costly issue. It has widespread implications for the individual, family, and society. It's multifaceted. It's a confusing topic at times, too, because a lot of the research literature, some of it is pretty outdated. There's not a lot of newer research coming out on these topics. So if you are a researcher, this is an excellent area to dig into. From my own professional experience, I don't feel like juvenile fire setting is on the radar of a lot of mental health or criminal justice professionals. And I believe that's the case because there's just not a lot of training programs out there typically in master's level mental health professional type of school programs. There's very little discussion, if at all, related to fire setting behaviors. So again, I think it's very important to seek out additional training, education, and consultation related to these topics if you are encountering a youth who sets fires. This is a quote provided to me by one of my good associates, Kathy Osmundson, and she's going to say a few words today, later on in today's PowerPoint presentation. But what Kathy indicates is youth fire setting is a larger problem than most people think. The media often glorify fire and represent it irresponsibly. People don't understand that we lose kids in fires that they set every year. When forensic mental health and fire service professionals are trained in youth fire setting and youth intervention, the intervention and diversion is highly successful in stopping the dangerous behavior. This is a good reminder that interest in fire is not always problematic. It's normal for most people to have a curiosity about fire. And we'll see that in our just own society with birthdays and celebratory events and weddings and religious ceremonies and holidays. But keeping in mind that even just the minor slight interest in a fire versus something that's very problematic, it can be just as dangerous, because fire can become out of control quite quickly. Depending on the age of the youth, that can be extremely problematic too. A younger child who sets fires may not understand the ramifications on how one match could burn down an entire house. Fire setting can also be a costly antisocial behavior. Now keep in mind that not all youth who set fires are antisocial, but children who set fires repeatedly with intent oftentimes kind of fall under the umbrella of having some sort of antisocial behavior. And some of the behaviors to look out for if you are dealing with a youth who falls under that umbrella or category is what's their level of aggression toward others, animals in some cases, or toward themselves. Do they have a history of being defiant? Or do they have a long history of deceitfulness? A couple other things just to ask yourself too is, do they have a long history of vandalism, lying, cheating, stealing, or threatening type behaviors, or bullying, or just arguing with adult figures? Do they have a short fuse, a short temper? Do they utilize fire as a means to control others, or do they utilize it as a means to reduce negative emotion in themselves? Does the individual seem to exhibit a lack of remorse or a lack of empathy? These are all very important target areas if you're a mental health professional or a fire and life safety education professional to target as part of a curriculum to help the youth avoid these behaviors in the future. Needless to say, many variables involved when antisocial behavior and fire setting co-occur. Psychological variables, contextual variables, even biological variables. I think it's also important to look at the characteristics of the child, their developmental history. Have they had any history of trauma or abuse? What's their education level like? Mental health problems, substance use issues, and the list goes on, and we'll dig into that in a few minutes as well. So what are some of the ways in which children are exposed to fire early on in life? I spoke about this briefly a few minutes ago, but keep in mind different types of events: birthday candles, holidays, religious ceremonies, cigarettes, being exposed to cigarettes if a caregiver is smoking cigarettes, movies, television, barbecues, fireworks, weddings, funerals, social media. The list goes on and on and on. And these are other variables to take into account when you're working with the child or their family to develop an intervention plan that's going to be most appropriate for that youth. So being aware that there are many ways in which children are exposed to fire. We cannot limit all of them, but we need to be able to teach them positive means, positive usage of fire, teaching caregivers the importance too of monitoring, supervision. That is so important. So defining youth fire setting behaviors, many different types of definitions you'll find out in the literature. When we talk about match play, if you see match play in the second bullet point here, that could be more curiosity based. This could be a younger child lacking cause and effect, again, not understanding that a one match could burn down an entire house. Being aware, too, is the child is very gullible or suggestible and talked into doing things with fire as well. It can be very problematic. Being aware of their social media usage or access to online videos or games that promote fire usage. And I think it's also important to be aware if a caregiver finds a child in having access to matches or lighters or finding it on their possession, it's important to have a discussion with that child and to make sure that they're safe, making sure these ignition devices are locked up, making sure the child's properly monitored. And in some cases, again, parents may need education. They may not lack the cognitive sophistication to understand this complex and important topic. Couple other definitions just to be aware of. Fire setting is often used interchangeably with the legal term arson. Now I want to really hammer this home today that the overwhelming majority of children who set fires would not be classified as arsonist, but some do. There are definitely some that would fall under that umbrella. But if a child lights a fire out of curiosity, looking at intent, was there intent to intentionally set the fire or hurt or damage or defraud someone, or was it an accident and they're just so young and they lack that cause and effect thinking? It's a pervasive problem again, and again, many different variables to take into account. As we dig deeper into some of these variables, it's really important, I think, personally and professionally, and just some of the cases I've consulted on, is to rule out, has there ever been a history of trauma in the child's life? Have they been exposed to harsh conditions? Have they been exposed to traumatic life events? Is there a long history of psychiatric or substance use issues within the family and within the own child? What's the child's level of social competence? What we'll find from the research literature is that in a lot of cases, youth who intentionally set fires often lack social skills, so that could be another component to intervention strategies. What about their level of impulsivity? A lot of times you'll see youth fire setters really struggle with controlling impulsive urges, and that can be very problematic when fire is involved. When you're thinking about a youth too who sets fires repeatedly, consider the fact, are they dealing with any type of reduced cognitive functioning? And some of the things that can reduce cognitive functioning when we're talking about all of these other layers to consider is, does the child have any sleep deprivation going on? A lot of times when a child is dealing with trauma or mental health problems or other types of behavioral or emotional disorders, they may have issues with sleep. Difficulties with concentration or decision making. These are all things too that can really impact the overall intervention, screening, and treatment planning process for these youth as well. The vulnerabilities that youth who come in contact with the criminal justice system are often many and varied. And again, looking at their intellectual functioning deficits, I think, is important as well. How do they function in day-to-day life, particularly during times of stress? Are they dealing with any memory impairments? Are they highly suggestible and gullible? And all of that needs to be factored into a treatment plan when we're working with this population. So higher levels of need, lower levels of functioning, fewer strengths. So when we look at this through a lens of screening and assessment, these are extremely important target areas to be aware of. Because if you're working with someone who has lower functioning levels, a one-size-fits-all type of approach does not often work. It needs to be modified and tailored to match the youth's cognitive functioning capabilities. Their emotional and developmental age really need to be factored into account as well. So a good example is, let's say you're working with a 15-year-old youth who sets fires. Cognitively and emotionally, they may be functioning much lower than what their chronological age is. So it's really important to take that into account. Also consider some of the motives behind why these youth set fires. Obviously, looking at the desires, the intentions, and what keeps these behaviors going is so important. There's a need for greater awareness, obviously, understanding, and research related to these topics. So unintentional fire setting may prove to be just as deadly as intentional fire setting. Again, goes back to an example of a young child lighting a cigarette or lighting a match, not understanding that cause and effect. And what research has shown to date is that a high percentage of fatal fires in homes that are started by children are started in the child's bedroom, and it really takes over quickly and they don't realize until it's too late. It's also important, if a child has a history of setting fires, do they have a history of setting fires on the way to school or at the bus stop or in other places as well? It's really important to look at that child's day-to-day activities and look at those target areas, and maybe additional supervision needs to be taken into account. A couple other things when we talk about young children who set fires, it's very important to consider the developmental phases associated with youth fire setting. There's an author in 1996 named Gaynor who published an article that talked about 3 developmental phases associated with youth fire setting, and the first phase was fire interest. The second phase was fire play or fire experimentation, and the third phase was fire setting. And when we break these phases down, it's really important to examine the child's overall progression with fire. And it usually starts with minor progressions and builds up and up. So these are important target areas, and again, why earlier intervention and identification is so important. It's also important to look at, has this child's interest in fire setting intensified? If so, why has it intensified? What are those variables that's making that child to have more of a stronger interest in fire? What are the role of the caregivers in these situations? And being aware of what intervention strategies would be most appropriate for this particular population. A little bit more about some of the terminology just out there. We could do a full day training just on pyromania alone. It's a really important topic. If you want to learn more about pyromania, I would recommend going to the chapter in the Diagnostic and Statistical Manual of Mental Health Disorders titled Disruptive Impulse Control and Conduct Disorders. The overwhelming majority of children are never diagnosed with pyromania. But according to the DSM-5, a primary diagnosis of pyromania is rare. I'm just going to give you a brief overview of what the DSM-5 says about pyromania so you have just a general understanding of that. It's most likely to occur in males with poor social skills and learning difficulties. Current and past histories of alcohol misuse are common among individuals who are diagnosed with pyromania. Pyromania is deliberate, it's purposeful, it's an act that occurs on more than one occasion. The individual will typically have tension or an effective arousal prior to the fire setting act. The individual has a fascination with fire, or has an interest in fire, or has a curiosity about fire, or an attraction to fire. In some cases, the fire may be used as a way for them to reduce stress, receive gratification, or they may receive these benefits from just witnessing a fire as well. So it's a very important topic to be aware of. We won't spend much time on that, but I just wanted to give you guys a brief overview of what pyromania is. Here's a little bit about the history of pyromania that's found in the DSM. I think it's a very interesting just chart to look at, looking at the DSM-1 going back to 1952 and then all the way up to the ICD-10 that's currently in use. But what we do know from the research literature about pyromania is that there's limited research on this topic. So another great area for scholars and researchers to investigate. The research is also lacking on some of the long-term outcomes associated with pyromania. So what happens to these individuals later in life? So another great area to investigate. And just a recap of pyromania. Interestingly, what the DSM-5 also indicates is that pyromania also co-occurs with a gambling disorder and sometimes depressive disorder, bipolar disorders, and other disruptive impulse control conduct disorder types of issues. So it's definitely not a disorder that is in isolation. Oftentimes, if you see someone who has a diagnosis of pyromania, they're going to present with a host of needs and issues. If you are looking to build a competency in these areas, this is a list of search terms. I would recommend starting to look at articles or go to Google and Google this, but these are some of the main search terms or key terms you'll find in the research literature related to these topics. Again, very important takeaway point is keeping in mind that just because a child shows an interest in fire, it doesn't necessarily mean that it's abnormal or they're psychologically impaired or they're going to grow up to be a pyromaniac. That's not the case at all. But just keeping an eye on that, being aware of that, has the curiosity grown? Are they starting to act out that? Are they starting to obsess or fantasize about it? But I think when we think about this and fire setting within this context, we always have to ask ourselves, what is the level of parental supervision? Is there proper adult supervision and modeling behaviors in place? Or is there parental dysfunction and kids are coming and going, there's not a lot of structure, cigarettes, lighters are very accessible to the child? But I think it's also important to, if you're an intervention specialist, to look at what life stressors are currently going on for that child. Is there conflict going on? Are the parents going through a divorce or separation? Is there abuse or neglect going on? Is the child exposed to a caregiver who has severe mental health problems or substance use issues? Or are they dealing with issues of poverty or homelessness or a host of medical health issues? So again, the needs of this population are often many and varied. When we talk about gender, there's not a lot of research out there that is found related to female juvenile fire setters. There are some, but I will definitely direct you to some of the other articles if you're interested in that. Just send me an email. If you're working with a female who sets fires intentionally and repeatedly, in some cases they may meet diagnostic criteria for a mood or behavioral disorder. What we have found from some of the research literature is the fact that they may have higher rates of psychiatric disorders as well. Female juvenile fire setters may have a higher prevalence rate of mental health problems. They may have a higher frequency of various forms of trauma, particularly sexual abuse. So it's very important to rule that out. Looking at, have they had any history of conduct disorder types of diagnoses? Being aware of that, how that factors into treatment. Have they ever had a history of substance misuse, cannabis use? All of these things are target areas for treatment professionals to be aware of. This is a key research finding just to be aware of, but the key takeaway points from this are vandalism, a cry for help, and alcohol misuse. These are additional target areas for clinicians to be aware of. Very important reminder about curiosity, and I highlighted recidivism here because I think it's very important to have a discussion about that topic. Obviously, once a youth who sets fires has been identified, our goal as professionals is to make sure and help that youth learn skills and implement strategies and have supports and services in place to help them not repeat this cycle of behavior. Some of the things that have been found in the research literature that pinpoint maybe an increase in recidivism among this population is obviously being in a caregiving environment that's full of conflict, stress, lacks discipline, exposure to stressful events, lots of hostility, or parents who are just checked out and just have maybe a neglectful type of attitude or behaviors to their child. So it's very important to take that into account. Fire setting is an unusual crime as it's easy to perform but difficult to detect. Very important to talk about. The overwhelming majority of, according to research, fires are not detected early on, not reported to the police, not reported to the fire service. So exact prevalence rates of youth-facilitated fire setting is really unknown for many reasons. And some of these reasons are fire department may be canceled if the fire is extinguished before they arrive upon the scene. That could be one variable to take into account. Another variable would be police officers may not report a youth set fire to the fire department unless extinguishment is required. Parents in some cases may not report a small fire set by their child because they don't want to get the child into trouble, or they didn't think it maybe was a big deal, it just seemed age appropriate for that individual. If a child's lighting fires and being sneaky about it, it's a problem, and get people involved, get someone to talk to the child, have the child evaluated. Schools often do not report fires set by students if they do not require a fire department response. And if you're a mental health clinician, therapists may not be aware that help's available from the fire service in many states. So those are some of the reasons you'll find in the research literature as to why maybe detection is difficult and actual prevalence rates are limited. So I spoke about this just a little while ago, but I think it's important to recap this. But it's when we look at these developmental phases, I think it's also important to consider what predictive characteristics are out there found in the research literature. And there's a lot of them out there, but keep in mind a lot of the research, again, is somewhat outdated, but I think it's still important to review. So if a child has a high level of aggressive behavior, I think that's very important to rule out. Where did this aggressive behavior come from? Why did it start? I think another thing to take it a step further is if the child's had a long history of aggressiveness, have they ever had a broken bone history, concussion history? It's important to take that into account because if the child has had a long history of fighting, getting into fights, having broken bones, concussions, they may be at higher risk of having a traumatic brain injury, which can definitely impact their ability to navigate their way through some of these complex processes during treatment. Social skill development is another area to be aware of. Friendship history. Have they had a history of rejection? What is their level of antisocial types of behaviors, the truancy, withdrawing from the home, such as running away, lying? And then the dysfunctional family environment. Very important to take that into account. Another important reminder, and I'm going to take this slide a step further, is in 1995, there's an author by the name of Feynman who created a typology of Firesetters, which has two broad types. Each of those two broad types has several different subtypes underneath them. I want to break that down for you just so you know that this is a really complex topic and not all Firesetters fall into the same category, so it's important to be aware of that. So the two main subtypes are non-pathological and pathological. The variables or the subtypes that fall under non-pathological are curiosity Firesetters. Keep in mind extreme curiosity has been linked to future problematic fire setting as well. And then under the non-pathological, the other one would be accidental fire setting. Under the pathological subtypes, you have the cry for help fire setter. You have the delinquent fire setter, which could be more related to conduct disorder. You have the severely disturbed fire setter. This may include a child with a psychotic disorder. Or you have the cognitively impaired fire setter. This could be a fire setter who has autism spectrum disorder, fetal alcohol spectrum disorder, or some sort of brain-based injury. And then you have the social cultural fire setter. You'll also find in the literature as well a crisis motivated fire setter. This may be someone or a child who may feel ineffective or highly anxious and powerless in the world. They almost feel like they're out of control, and fire may be used as a way to regain control, and it could be used as a calming mechanism. So this is why it's important for professionals who understand this topic to accurately assess, diagnose, and really understand the motivations around some of these behaviors. These are some of the characteristics associated with fire setting in adolescents you'll find in the research literature. I did a systematic review of the literature to prepare this PowerPoint, and as you can see, some of these are kind of outdated. Some are fairly newer. But it's important to be aware of when we look at these risk factors to consider the child's traits. For example, do they have any learning problems, attachment issues, attention deficits? Have they ever been diagnosed with ADHD or any type of other childhood behavioral disorder? Has there ever been a history of prenatal substance use exposure? What is their level of impulsivity? How do they deal with empathy? Do they understand empathy? Are they able to show remorse? Do they have any executive functioning impairments? So what is executive functioning impairments? That would be something to the effect of they're dealing with issues with decision making, planning, reasoning, learning, logic. That's that prefrontal cortex of the brain. It's so important for just managing overall day-to-day behaviors. I think it's also important to really look at the child's overall environment and family setting. So for example, again, we've talked about this in detail, but looking at the family's strengths, the weaknesses, the limitations, what's the family's thoughts and beliefs about fire? What's their discipline style if they did catch a child lighting a fire? What's parental modeling like? These are all factors to consider. A few other traits just to be aware of you'll find in the research literature. Again, males, much more common than females. You'll see higher rates of ADHD diagnosed in this population. In some cases, you'll see conduct disorder. It's not the overwhelming majority, but definitely in some cases, you'll see that diagnosis, particularly with antisocial types of behaviors and fire setting behaviors that are repetitive over long periods of time. And then, again, just being aware of the family parental pathology component of it as well. Now, I've come across a few articles that talk about some of the characteristics of severe fire setters, and the way they differentiate that is versus like a one-time fire setter based on curiosity, or a severe fire setter who's doing it repeatedly with intent. What the research has found that these severe fire setters have a longer history of abuse, trauma, neglect, often power struggles with adults. They have a history of smoking. Binge drinking has been more common among severe fire setters. Cannabis use. Impulsive and risky decision-making and behaviors, and higher rates of mental health problems have been found in more severe fire-setting types of behaviors. 6 distinct reasons why juvenile fire setters committed arson. This is an article I would direct you to, and if you're looking for full citations, please don't hesitate to send me an email. These are some of the reasons that you'll find in the literature. Some of the other reasons, like the possible motivations that are found in the research literature that go deeper into this topic, would be, did the individual ignite a fire as a result of peer pressure? So I think it's really important to consider that peer pressure component. And that's where that level of suggestibility and gullibleness comes into play. In some cases, I don't see this that common in youth, but maybe using fire as a form of communication. Are they trying to conceal another crime? Was it for self-protection? Was it out of revenge? So there's a lot of things to consider when we're talking about this topic. Some of the other motivations from older studies that are out there in the research literature to be aware of. Anger, too, has been found as a possible motive in some of the older studies. Rage control problems. Does the individual have excitement with extinguishing the fire, putting the fire out? Is it a craving for recognition or attention? Are they just arrogant and they don't understand that cause and effect dynamic? The group and peer influence is such an important topic, again, just to really hammer that home. Taking that a step further, not just the group and peer influence, but parental influence as well. The adult modeling of inappropriate use of fire, the availability of matches and lighters. What's the direct experience with fire? Lack of experience with fire may be more problematic too, especially for the young children if they're not being modeled appropriately and taught by caregivers and parents. Maybe they learned something on YouTube and they act it out in their backyard, which can have problematic and dangerous outcomes. And then, do they have any maladaptive fire behaviors? Needless to say, the consequences for fire setting are many and varied. Loss of life, loss of trust, criminal justice involvement, in some cases child protection involvement, depending on the situation. It could be a high level of guilt and shame by caregivers or by the youth. It could be a contributing factor in some cases of mental health problems. Lost friendships, strained family relationships. It could be loss of employment if the youth is employed somewhere. And it could relate to a host of medical health problems too, respiratory issues, burn-related issues. As we move into statistics, I put a number of different statistics in here. By no means are these all of them. This kind of gives you a snapshot of kind of what the research literature says. Keep in mind some of these vary between study, some have smaller sample sizes, some are older, some are international statistics. But I'll just move through these quite quickly. But these are just some of the ones you'll find in the research literature. Again, juveniles make up a sizable percentage of fire-setting behaviors and crimes in the United States, according to the FBI. According to the FBI crime data between 1986 and 1994, children and adolescents accounted for between 40 to 49% of arrests for arson. This peaked in 1994 at 55% and then declined by 50% by 1988. Again, some of these are older, but it kind of gives you a snapshot of where things were at that time. Some fast facts to be aware of: among juveniles, fire setting is more prevalent in males than females. 60% of all fires in large U.S. cities are lit by individuals between 11 years and 18 years of age. It's important to also note that there are some youth who set fires that are much younger than 11 years of age. Obviously, the younger the child, it becomes more rare, but it can become even more dangerous because of the fact they lack that cause and effect thinking. Some other statistics from various community samples in the United States and the United Kingdom just to be aware of. National Fire Protection Association has some good statistics there. There's a link here on that slide as well. I mean, many people die from fires every year. Many injuries happen and significant loss of revenue, property damage as a result of fire as well. So some of these statistics you'll see, like how many youth actually engage in fire setting behaviors, and that's where some of these statistics get kind of tricky, and you'll see them really all over the map. And again, that it's depending on what kind of sample size the researchers were using, among other variables. Some other websites here, I would definitely recommend checking out these websites, or actually the same one, with some good statistics. And needless to say that 2 slides ago, just I wanted to point out some of the statistics, how they do vary. Some good statistics out of New York here I found, just wanted to show all of you. I think it just kind of highlights kind of where things are at. In 2002, children were responsible for an estimated just under 14,000 structural fires, which led to 1,250 injuries and 210 deaths. Another study from New York, British Columbia, New Zealand, with some of the international statistics to be aware of. There's some good information that definitely comes out of Europe and New Zealand related to some of these topics. Australia has some good research. It's an international problem. It does not just impact the United States. Some of the historical information, there's definitely some good historical information out there. There was a typology, or 6 different categories that were discussed back in the 1970s, and I can't recall the author's name at this time, but the 6 categories at that time that this author identified were related to revenge, excitement, institutionalized, so a fire setting in a mental health facility in order to be relocated, insurance claims, vandalism, and crime concealment. So looking at some of these years of publication, definitely older, but I think it's very important when you want to understand this topic, obviously, to look at the historical context as well. Some other historical facts just to be aware of. Obviously, authors dating back to the 60s and before really saw this as a problem that involved multiple factors, and even back then in the 60s they referred to this as a complex phenomenon. Some other good historical information just to be aware of, and what the history has found for some of this historical information is really looking at that family dysfunction. Was there any history of alcoholism, psychosis, criminality in the family? So as we move into screening and assessment considerations, early intervention is key, no doubt about that. And I think the earlier we can identify these youth, the better off these youth are going to be. Society's going to be better off. The families are going to be better off. But if we can really take a step back and look at fire setting during preschool years, what are those variables that we might want to look for if a youth is starting to set fires when they're very, very young? And generally, not all cases, but most of the time, it's going to be curiosity-based. They may just lack an overall knowledge or awareness about fire when they're very young. Unfortunately, the research points to the fact when this is the case, the fire could be more destructive and more likely to result in injury or property destruction. And some of the older research has found that approximately 2/3 of fatal fires are started by those aged 5 or younger. So again, that goes back to the issue of, does the child really understand the cause and effect with fire? Are they dealing with a number of cognitive issues as well, which puts them even at greater risk? And just being aware that poor planning and limited understanding are recipes for disaster when we're talking about youth who are very young who set fires. Within clinical settings, if you're working in mental health treatment settings, many things to be aware of when we talk about this population. But keep in mind, if you're working with juvenile firesetters who are involved in like inpatient treatment, outpatient settings, to be aware of, they may have a higher number of needs, behavioral needs, emotional needs, and even physical health needs that need to be taken into account. So again, early intervention is key in those places. Treatment is paramount. Getting these supports and services in place, teaching these children the skills they need to be successful when they're not in these settings. And address the family needs as well. It cannot be done through an individual lens, in my opinion. Ruling out any other types of emotional behavioral issues, but looking also at what are their triggers, coping strategies, and their needs, their wants, and their risk. Focusing on the positives too. What are they good at? What are their strengths? But also looking at their limitations. Childhood fire setting, like any other behaviors which are dangerous to oneself or others, is a true psychiatric emergency. So why is that the case? Obviously, it can be extremely dangerous to the child, those around them. But children who set fires, this could be a cry for help. That could be a red flag indicator that this child is dealing with a lot of things that it's beyond their control. They need third-party intervention. So again, when a child starts to set a fire, obviously finding out what is the motivation, what's the intent behind it, the frequency, the severity of it. Was it that one-time event? Was it only a one-time event because the child was under constant supervision? Was it only a minor fire because it was extinguished immediately? Keep those in mind. Some other risk factors to be aware of. Looking at the historical factors as well. Are they dealing with any social type of disadvantage? Rejection, bullying, teasing, lack of support, social support, lack of support from their family, lack of access to things that can help them be successful in school. Do they have any history of fire experimentation or fire interest or fire fascination? Is it grown to the point of obsession and that's all they're thinking about and talking about? And looking at any environmental reinforcers that reinforce the fire setting behavior. So for example, like any external variables going on in their environment or within their home, are there any internal variables that are contributing to this within them? Thoughts, beliefs, emotions, intents, or any sensory reinforcement. And I'll talk about sensory in just a few minutes. Important reminder about identification. Again, we want to look at their motivations, being aware of the risk factors, the onset, what continues to drive this behavior, and what can be put into place to help them not do this behavior anymore is key. Evaluation, another important reminder to be aware of. Causes of youth fire setting can range from a lack of knowledge or understanding regarding appropriate fire use to deep-seated pathology. So when we're dealing with a child who lacks that knowledge, basic fire education for the child and the family may be appropriate. When they're dealing with deep-seated pathology, mental health problems, that may be outside of the scope of a traditional fire setting protocol. They may need inpatient treatment, outpatient treatment, or treatment from a multidisciplinary group of professionals. Other motivations may be connected to physical health, ruling out any type of physical health issues, seizures, sleep issues, digestive problems, mental health problems, trauma, anxiety, depression, behavioral health, just the emotional impulsivity component. Only a thorough and comprehensive evaluation will determine the youth's needs in order to desist from fire setting and re-engage in a safe and productive lifestyle. There's a variety of instruments used out there. So the question always is, what's the best tool to use for this group of individuals? And that is an impossible question to answer, because you really want to look at what is the tool that best helps identify this child's risk. You want to make sure the tool has been developed for that particular population, making sure the tool is useful to the program that you're serving. Was the tool designed to evaluate the behavior in the context of the individual who set the fire? Keep in mind, there's not one tool that's going to capture every type of issue or risk factor, disability that the child may be dealing with. It might require multiple screening methods and approaches depending on the intended population. It's also important to make sure that the tool is well validated, studied, supported in research. Is the tool culturally sensitive and appropriate? Is it gender appropriate? For example, was the tool originally developed just for male use? And are you using it with female use? Was it developed appropriately? Is the tool developmentally and emotionally appropriate for the child as well? Does it take into account the child's verbal abilities, their cognitive capacities? So many variables to take into account. These are some of the tools, assessments, questionnaires, screening inventories found in the research literature. I am not endorsing any one of these particular tools. If you ever are trying to determine which tool would be best for your department or for your organization, I always recommend consulting with an expert in the field, reviewing the research literature, and seeking out training and advice from other professionals who have used these tools. The importance of identifying individual and family factors is seen as crucial to providing an intervention that meets the needs of both the individual and the family. So some of those individual factors to pay attention to is, again, does the child have any anxiety or distress going on? Taking that into account when you're interviewing the child. What's the child's temperament like prior, during, and after the interview? Being aware that some of these children may have attachment disruptions that may impact the quality of the interview and the intervention approach. Does the child lack social reserves or cognitive capacity? Do they shut down quickly? What's their language ability like? Does the children struggle with being able to articulate their own thoughts, needs, wants, desires? What's the parent's attitude like? Caregivers. And keep in mind, too, is their overall memory capability. That's a very important variable to take into account, because if you're doing an intervention approach with these children, and some of these children may have cognitive disabilities that may impact their ability to hold information in their mind and retain it and use it later on, they may need modifications to the interviewing approach and the intervention approach because of those memory deficits. Some of the other key variables to take into account, these are just a few that I have personally observed on some of the cases I've consulted on. Has the child been diagnosed with ADHD? What is their adaptive functioning capabilities like? So for example, how do they function in day-to-day life? Are they able to get up on their own? Do they need constant reminders? Do they forget to eat? Do they forget to take care of themselves? Daily hygiene? Do they need constant reminders to go to school? That would be some of the domains that fall under adaptive functioning. Has the child ever dealt with any adverse childhood experiences, so neglect, trauma, abuse? Does the child have any level of anger, rage, or hatred? If so, why is that the case? When did it start? Who is that directed to? Any history of animal abuse? Any history of attachment issues or neurocognitive behavioral issues? What is going on in that family? Any social skill deficits? Any exposure to substance use issues? There's very little literature out there in the fire setting world that discusses how you interact with a youth who sets fires who has a head injury. But what we know from the general research literature regarding juvenile justice populations, the rate of head injury are very common in that population. So definitely if you're interviewing a child who is involved in the criminal justice repeatedly who sets fires, it's important to consider, have they had a history of head injury? Head injury can come from accidents, falls, getting in fights, domestic violence, histories of abuse. Being aware that head injuries, particularly when unaddressed, untreated, underidentified, can lead to organizational deficits for the child. They may have issues with focusing. They may have issues with regulating their emotions during times of stress. Their memory can be impacted. Time management issues can be impacted. They might have a very difficult time finding words in some cases to respond to a question. They may need extra time to respond to a question. Another very important variable is maternal relationship. What is the child's relationship like with mother? Was there ever a level of cruelty between mom and child? Does the mom have mental health issues? What's her disciplinary style like? Has she had any issues of putting that child almost in an adult-like role? A lot of variables to take into account there as well. Attachment and bonding, another very important consideration to take into account during the screening process. Has the child had any abnormal bonding experiences early on in life? Have they been involved in the child welfare system? Have they been taken from the home for a period of time? Are they living with non-relatives, foster care, adoption? Has there been an absence of bonding or nurturance? The trauma history there, any developmental failures? Were they born with some sort of disability that prevented them to connect with mom or dad? Do they feel like they've been rejected by caregivers or even by society? Foster care, there's just a handful of articles out there that talk about foster care and fire setting. This is a good piece of information just to be aware of when it relates to this topic. Loneliness, social isolation, another good target area for treatment professionals. If you're dealing with a child who has these issues, does the child have any meaningful relationships as they grow up? If so, who are they? Do they have a coach or a mentor? Does the child lack the capacity to really forge positive relationships? If so, what are those disabilities and deficits that are getting in the way? Is the child a loner in school? Are they just always alone? Is the child bullied and teased? If so, by whom? Is it by family members as well as strangers? And just being aware of, when I've worked with a lot of adult clients, not necessarily just not fire setting clients, just clients in general that have a lot of needs, emotional, mental health needs. When they're dealing with social isolation and loneliness, a lot of my clients are on social media and get heavily involved in social media content. And some of the clients I've worked with have been on social media 12 hours a day in some cases. So that's another variable to look at, is where are they getting their information from? Who influences them? Is it social media? I spoke about this briefly before, but rejection. I think this is a really important component. Even perceived rejection. This could be an outcome of childhood trauma. This could definitely be a variable in the child's ability to cope with stress. This could be a triggering event for fire setting behaviors in some cases. Definitely this could lead to attachment irregularities or insecurities. This could lead to issues of just losing control, emotional meltdown, mental health problems. As the child ages, it could be a risk factor in substance use issues. Looking at those triggering factors, what are those factors that trigger that youth to set fires? Is it the rejection? Is it isolation? Is it mental health problems? Is it fantasy? Is it unresolved trauma? Is it mental health issues? Are they trying to get the attention of someone? Are they trying to impress someone? Are they gullible and talked into it? Again, many triggers to be aware of. A lot of times youth who set fires repeatedly are often going to have problems in school. So any history of truancy or classroom behavioral problems. Are they dealing with any learning problems or academic failures? Have they dropped out of school? Looking at all of that, those are other target areas to be aware of, getting the supports and services put into place. Some of the other variables too there, are they dealing with any attention and concentration or memory problems? And are they in special education or on some other form of academic assistance? Something else to consider, I think it's just an important reminder, when a child is experiencing abuse or bullying in some part of their life, playing with fire may be a means to experience control over something powerful. When you're working with this population, I think it's imperative to utilize a trauma-informed care approach and take into account that a high percentage of these kids may have had some issues with trauma early on in life. A few other variables to just be aware of: the overall attitudes and beliefs, the values and experiences all around fire. So a fire-specific assessment, these are some of the domains you might want to consider, but looking at, are they dealing with any antisocial behaviors? And that could even be covert aggression, criminal thinking beliefs. I think it's important to also look at who's the target, who's the intended target? Was there an intended target? Were they trying to destroy property, or were they trying to destroy, hurt somebody? Looking at their developmental IQ level as well as part of a comprehensive assessment, not just what their IQ level is, but what their adaptive functioning level is. How do they function in day-to-day life? Looking at their social supports, their psychiatric history, parental functioning and practices. So many domains to consider, but these are some of the big ones just to be aware of. Some of the kids too, particularly the ones that are dealing with kind of more of those antisocial behaviors, may be engaging in fire setting in some cases as a form of thrill-seeking behaviors, which can be obviously very problematic as well, so trying to rule that out. And then when we talk about some of those covert behaviors, some of those more antisocial behaviors, again, is there a level of deception there, manipulation or revenge? And does the youth have any thoughts or harm to kill another person or persons, and using fire as a weapon or means to do that? So this can be some serious stuff too to take into account. When you are working with female fire setters, obviously most of the other things I spoke about would apply, but these are some of the variables to take into account. Again, trauma history, very important to rule out. Any social problems, social disorganization, and just always going back to the family of origin. What's going on with the family of origin? In some cases too, with that trauma history, just taking that into account, how that factors into these behaviors, and then just being mindful again of using those trauma-informed care approaches. I briefly spoke about executive functioning before, but I wanted to reiterate the importance of considering this during an evaluation or screening process. Executive functioning, again, are those domains of like attention, goal setting, planning, prioritizing. It could be flexible thinking, being able to compare and contrast information and options, being able to foresee the consequences of their actions, self-driven, self-motivation, emotional regulation. All of those are going to come into play. Now, if someone's dealing with issues in these areas, that could really impact the way they're able to successfully complete treatment. I give a lot of talks on topics related to memory. I think it's a very important topic for all of us to be aware of. When you're dealing with youth who set fires, who have all of these cognitive impairments, a lot of times they may be dealing with memory issues. That has to be considered during the intervention and screening process. There's many consequences associated with memory-related issues. The child could become more angry. It could lead to issues of having false impressions by others. It could definitely impact their overall treatment compliance. It could lead to vulnerability, increased risk of just being talked into things, forgetting things, learning problems, and the list goes on. Part of the discussion on memory is low working memory. And this is another very important component to consider during the evaluation process. And this is going to be evaluated by a qualified mental health professional who has training in this area. But if you're working with really complex, severely disturbed, mentally ill youth fire setters, it's really important to consider these domains. So working memory in the research literature has been referred to a powerful cognitive skill. It's involved in complex cognitive activities. Some scholars have actually called it the brain's post-it note. It's an updated system. It's like an active mental workspace. So it's very important for us to understand this and take this into account during a treatment process. A couple things to be aware of with when someone has working memory issues, they might not make progress in treatment when it's not taken into account. They may appear to lack motivation or direction when in fact they want to have motivation, they want to be able to be self-driven, but if they're dealing with issues with working memory, they might have some issues in that area. They could be easily distracted too during the interviewing process, so being aware of that. If they shut down quickly and they become emotionally dysregulated, that could be a red flag indicator that their working memory may be overloaded. They may forget what they just said to you and repeat something or say something completely different than what they said 2 minutes ago. Depression, anxiety, guilt, it is common for people with really poor working memory issues. You'll see poor working memory issues common among children with certain neurobehavioral disorders. It's common among people with ADHD. It can definitely impact overall comprehension, learning, problem solving, decision making, and reasoning. So again, really important area to consider. Inhibition, another very important component that falls under the umbrella of executive functioning. So really think of inhibition as the child's ability to kind of put the brakes on their thoughts. It really slows down impulses. It's almost a filter, so they're able to think through their actions. Now keep in mind, if a child has issues in this area, they may really struggle with controlling their impulses. And when it comes to fire, obviously that's a huge issue to take into account. When we talk about inhibition deficits and all of these issues too, consider just self-regulation deficits and how that can lead to these fire-setting behaviors. So the impulsivity, the low frustration tolerance, anger, inappropriate goal setting as well, or just overall poor coping strategies. We could spend a whole day on this topic as well, but if you're a screening professional, a mental health professional, and you really want to do a comprehensive evaluation of a youth who sets fires and really find out what's going on, it would be imperative to really consider the child's auditory processing capabilities, their information processing, their intellectual functioning, and their sensory processing deficits. So when you're dealing with a child that has auditory processing deficits, they may have a really difficult time following instructions. They may be easily distracted. They could become very bothered by loud noises. So consider sirens. That could definitely set that child off emotionally. Another thing to consider, a good red flag indicator, is does the child seem to hear but really not listen? Do they have a difficult time really understanding speech or just following instructions in a noisy environment? So really struggling in those areas. When someone with information processing deficits presents, they may need extra time to process information. I can think back a few years ago, I worked with an adult client with fetal alcohol spectrum disorders, and I would ask this client questions. It would literally take this individual about 15 seconds to respond to a question. I knew that this person had information processing deficits, so to the untrained observer, to the untrained interviewer, if that's the case and you didn't pick up on the fact that they had information processing issues, you may think they're ignoring you, and then you go into asking more questions. Rapid fire questioning can shut down the brain of these individuals, and they can become very dysregulated very quickly. Sensory processing, just a few other takeaway points to be aware of, but being aware of sirens and the flashing lights, the use of equipment by emergency services. If you're interviewing someone in an office setting, if you're an investigator, mental health professional, being aware of office clutter, bright lights, all of those can factor into this. Adaptive functioning, spoke about that a little bit, but going into a little bit more detail, it's a very important domain to consider. I think it's one of the most important domains to consider when you're developing a goal plan, treatment plan for this population. So when we talk about adaptive behavior, it's really broken down into 3 domains. So you have the conceptual domain, social domain, and practical domain. So under the conceptual domain of adaptive behavior, you would have memory, language and reading and writing and math and reasoning, problem solving and judgment in novel situations. Under that social domain, it'd be awareness of others, thoughts, feelings, and experiences. Under that same domain, you'd have empathy, interpersonal communication, friendship abilities. And then under the practical domain, you'd have personal self-care, employment, money management, self-management of behaviors. Keep in mind, if you're working with a youth who's in like a secure treatment setting or a juvenile detention setting, it's difficult to determine level of dysfunction in this area when it's in a controlled setting. It's when they're not in a controlled setting, it's much easier to tell that they're dealing with issues of adaptive behavior, adaptive functioning deficits. And it can really have a snowball effect on someone too. All these behaviors aren't taken into account. It can really lead to long-term problematic outcomes. A topic that I love to talk about that's really not really considered too much within the fire service, but it's such an important topic to consider when you're screening and assessing and working with really anyone, is do they have theory of mind deficits? What is theory of mind? So theory of mind is a skill to appreciate that the behavior of others is driven by the beliefs, desires, and mental states of others. So basically, does the person understand emotional states of others? So thoughts, desires, beliefs, intentions, and knowledge. When someone has issues in theory of mind, they may misread social cues, or they may not understand unwritten societal rules. They may look like or exhibit reduced empathy, or they have a reduced understanding of their own thoughts, feelings, and actions. And they have a really reduced ability to accept opinions from others. So needless to say, this is an important domain to consider when you're trying to interact and communicate with and teach a youth the skills and interventions and tools they need to stop fire-setting behavior. Social skill deficits, these are just some of the ones to be aware of and screen for when you're working with this population. Some of the environmental considerations to take into account, again, so important to consider what's going on in the family, access to ignition devices, cigarettes, who's reinforcing the behavior, who's putting in the strong support and structure. These are other topics I often talk about, but we could spend many hours just on these four, but these are other variables I think very important to consider if you're a treatment clinician, a mental health professional, is what is the child's inferential skills. So this really look at it. Inferential skills is a prerequisite for higher order thinking. So kind of looking at their overall logical thinking. Are they able to use prior knowledge? Are they able to connect pieces of information together? When we talk about abstract reasoning, are they quickly able to identify patterns and solve problems and apply knowledge to solving problems and dealing with these issues in life? Perspective taking is really another form of theory of mind. And metacognitive skills, just another very important variable to be aware of. Thinking about one's own feelings or being able to reflect and evaluate things. Obviously, young kids will struggle in these areas. If you're working with older children, youth, teenagers, these are areas that are hopefully developing. These are skills that can be taught and hopefully improved on in time. Other target areas in treatment to be aware of. Another important reminder regarding just clinical experience from these authors. So as we move into intervention and treatment considerations, this is a really good avenue to talk about fire education. I'm going to have Kathy Osmussen just say just a few words about the services in Minnesota and what she does with the Minnesota State Fire Marshal's Office.
Well, thank you, Jerrod. Thank you for inviting me to your webinar. I work with the Minnesota State Fire Marshal Division as a Deputy State Fire Marshal, and one of my duties is to coordinate the statewide youth fire intervention team. And what our team does is the fire education piece of this intervention. We have many tools that we can use, activities we can use with the kids depending on their age and their cognitive abilities. We also teach them about fire science, how fire works, the consequences of irresponsibly using fire. And we work with the parents as well, parents and or caregivers, because those are the people responsible for their safety. Most people don't fully understand the way that fire works, how fast it can be, how dangerous it can be, how every big fire starts as a small fire. Just because their child is setting small fires doesn't mean that this behavior is any less dangerous. So we provide the full spectrum of fire behavior, fire science, consequences, and we reinforce that with various activities. This is a service that's provided throughout the state of Minnesota, and you can access that resource at the Minnesota State Fire Marshal Division website. If you happen to not be in Minnesota, there is a national website called Why Fires, and you can locate that website at yfires.com. And there they have a directory that will help you locate a fire resource, a fire intervention program. So if you have any questions, don't hesitate to find me. I can be found on the Minnesota State Fire Marshal Division website. And Jerrod, thank you again for inviting me to your webinar.
Thank you so much, Kathy. So, needless to say, fire education is very important. All the services that Kathy just spoke about, I would absolutely start becoming familiar with that. Reach out to her. She has a wealth of knowledge, experience in this area. Some other things to take into account when we talk about intervention and treatment considerations is mental health evaluation. Needless to say, and hopefully at this point we can see that many of these individuals who come into contact with the criminal justice system or mental health systems or fire service systems are dealing with a number of mental health needs. They're going to need to have a proper evaluation to find out what's going on. In my experience, many mental health professionals lack the necessary training around fire setting. So I encourage mental health professionals who are interested in developing a competency in this area is to reach out to qualified experts in the field and seek out their knowledge. I think it's also important to consider the fact, if you're in the criminal justice system, that restorative justice may be a component of this in some cases. I think it's also important, if you're working with families, to consider the caregiver support component in education. Families and the youth may need check-ins on a regular basis too. They may need in-home support. And as you're starting to develop an intervention and treatment plan for this population, I think it's really important to really know who and what you're dealing with. When you're working with an individual, looking at their unique strengths, needs, limitations. And by doing so, I think the only way to truly do that and get to know the person you're working with is obviously the face-to-face interview, interviewing collateral sources, reviewing criminal history printouts or arrest records or school records. Is there employment records you have access to? Other mental health records? Any other records that can give you a snapshot? Are there other records from the past, IEPs from school, neuropsychological evaluations? So the more data you can collect, obviously with having appropriate releases of information in place, would be great. This is just another important reminder that collaboration between fire department officials and mental health agencies is crucial. And that is part of the reason why we're doing today's webinar, looking at it more through a multidisciplinary lens. Because this is not just a fire service problem. This is not just a mental health problem. This is not a criminal justice problem or an education problem. It's a problem for all of these sectors, and you need to come together and work together as a team to help best interact, communicate, and treat these individuals. Some of the other psychological intervention and treatment approaches to consider here: educational interventions, definitely very appropriate for many of these individuals. Family therapy, family training, family coaching. Teaching parents maybe to have alternative disciplinary styles or strategies. In some cases, maybe there needs some parenting coaching to teach the parents to have more of a warmth approach with their child rather than a very aggressive, negative approach. Teaching everyone conflict resolution skills. They may need clinical intervention where it requires the assistance of a licensed mental health professional. Cognitive behavioral therapy or training. Social skills training. Adaptive functioning abilities, again, going back to that, very important. Looking at the memory capabilities, the sensory processing issues. So there's the needs are many and varied, and so are the treatment requirements for this population. Multidisciplinary teams, just to continue to highlight the importance of this. And a multidisciplinary team could be made up of fire service, probation in some cases, law enforcement professionals, child protection may be involved in some cases, mental health providers, school teachers, school officials, the family members, the caregivers, and the list goes on. But getting people involved who interact with this family and child on a regular basis is key. Mentoring programs, another great avenue for success with this population. Mentoring programs have been found to help the child establish meaningful relationships, really learning about their own identity. It can really help cognitive and emotionally process and help them grow in many different levels. Really helps them understand different behavioral attitudes as well, looking at like things they get stuck in, like errors in thinking, and helping them channel those thoughts, feelings, and emotions into something very positive. Mentors can also demonstrate supporting encouragement to children who need a little more encouragement in their life. Mentors can also show and teach compassion and empathy, so very important component. Needless to say, cross-training is important. That's why we're putting on today's webinar. We're hoping this will be one webinar of many that we'll offer in the future. But cross-training is so important. I want to learn from fire service. I want to learn from criminal justice. I want to learn from educators. I want to grow, and we need to keep an open mind, in my opinion, and learn from these different disciplines and what approaches work and what approaches don't work. Understanding the capacity of fire use. What is the youth's understanding of fire? What's their capacity with fire use and their overall concept of safety? Other target areas and treatment to be aware of. Very important to consider.
Jerrod, can I interrupt one more time?
Yes, please.
So as far as fire safety, I neglected to mention, we do teach the families about fire safety. We teach them to place smoke alarms inside every bedroom and at least one on every level of the house, and test them every month. And many people don't know that they only last for 10 years before they have to be replaced. So the safety aspect is safety as far as physical safety, not only from fire, but across all the realms there. Thank you.
Yes, thank you, Kathy, very much. So what happens if we're dealing with a youth who is in crisis as well? In some cases, that may be the case. Is there suicidal behavior at play? Is there self-injurious behavior? Are they in a crisis and they're just trying to communicate their own thoughts and behaviors in a way that to them seems logical, but to the rest of us is very problematic and dangerous? Is the youth who's in crisis just trying to gain attention and affection from others because they just feel abandoned by the world? What is their level of depression? Looking at their peer in the support network. Was there a recent history of trauma or loss or a death in the family or history of sexual abuse? When we're dealing with children who are in crisis, obviously getting them immediate medical attention, psychiatric attention, being aware of how the trauma is impacting them. When we talk about media and social influences, obviously it's really important for us to consider the impact of what the child is being viewed to and exposed to on a regular basis. And I think this really captures it quite well. But again, some of the children that we work with and interact with might be more fantasy prone. They might be more likely to go along with something. see something in a movie and act it out. That can be very problematic and very dangerous. So taking that into account when you are interacting with these youth. So youth fire setting is typically driven by a lack of knowledge. So teaching, education, what Kathy spoke about, the education component, the proper resources and interventions can help provide the youth with appropriate information to dissuade fire setting behaviors. The education could be in a video format, could be in role-playing activities, could be in structured group activities. It could be tailored individually, one-on-one. For more of the severe fire setters, there could be a component of mental health treatment in there. So again, looking at every youth individually and finding out what does that youth and family need. Developmental and chronological age, I mentioned this earlier on, but I really want to just remind all of you the importance of considering who you're working with through a developmental and emotional lens rather than a chronological lens. A couple other important reminders about treatment. Again, early detection, accurate differential diagnosis. When I use that term differential diagnosis, okay, the youth presents with fire setting behaviors, but what else is going on? What co-occurring issues are they having? The mental health, the substance use, could there be learning challenges, cognitive impairments? Being aware of the risk reoccurrence as well. Helping that child get supports in place and that family to prevent a future fire setting act is imperative. And getting those supports in place and taking it a step further. Some of these supports may need to be in place for many, many years. And depending on the child's deficits, disabilities, diagnoses, they may need lifelong supports. Clinical intervention. Again, this I think really reminds me of the importance of considering how trauma impacts the child and really take that into account when you're interacting, communicating with the child. These are two topics I often talk about, confabulation and suggestibility. Confabulation is the creation of a false memory. So the youth, if they confabulate, they may believe what they're saying to you is true when in fact it's not true. So it's very difficult to determine if it's a lie or not. But keep in mind, if someone's truly confabulating, there's no conscious intent to deceive or manipulate or lie. Most professionals, I don't think it's on their radar to consider these topics, but it's so important when you're interviewing these children and developing a goal plan, treatment plan, to consider these topics. Because if you don't and they are confabulating or they're highly suggestible, it can really taint the information you're collecting. It could lead to misdiagnosis. It could lead to ineffective goal planning, treatment planning. If it's a criminal justice investigator, in some cases it could lead to false reports, false information, false arrests, false imprisonment. These are some of the interviewing strategies just to keep in mind. Most of these are common sense, but when you're working with vulnerable populations, just being aware of using multi-step questions that are complicated and confusing. I say avoid yes or no questioning and true or false questioning because a lot of times someone with a cognitive impairment or some of these issues, or even younger children, may just go along with yes or no questioning and have no idea what they just went along with. So it's important to fact check and verify and be aware of that information. So it might be important to just consider using like direct language approaches as well. Obviously, avoiding any technical jargon, complex legal terminology, being aware of the vocabulary that child uses, trying to match their vocabulary to their cognitive functioning capabilities. Be aware of not using suggestive questioning approaches. So it's very important. I do a whole training just on these topics, but it's something just to consider when you're interviewing this population. A little bit more about direct language approaches just to be aware of. Just have a nice list here to consider. And consider unstructured time and unsupervised time for youth who set fires. These are other target areas for treatment professionals to be aware of. Getting the child involved in after-school activities, getting the mentorship, getting an in-home tutor, getting something to structure their time around kind of the downtime. If they live in a single parent household and one of the parents is working all the time and they're home with a lot of unstructured time, that can be very problematic. And another important reminder just about treatment, just to take into account. One more important reminder just to be aware of, I think these kind of just summarize some of the kind of takeaway points I want all of you to be aware of when we're talking about intervention approaches. And some of the strategies definitely might need to be more intensive. Some might need to be less intensive. It just depends on the child's overall social, emotional, family, and school functioning. So again, we have to look at each child individually. We could spend the whole day on just these topics. These are some of our goals with future trainings that we're hoping to put together, and really digging into the literature and research about fire setting within the context of these disabilities. But if you're working with problematic youth fire setters, juveniles who set fires repeatedly, in a lot of cases they may be diagnosed with ADHD. In some cases they may have a neurocognitive disorder. So it's important to learn about these topics, and we're hoping to go a little bit deeper into each of these topics in maybe some future webinar presentations. So just a few important reminders before we wrap up today. Again, when we're working with this complex topic, these complex kids, early diagnosis, early treatment, support for the family, the whole family system, it's important to have increased training for the professionals. We need to tailor approaches to meet the needs of these children, and consult with recognized experts in the field when you're working with some of these complex cases. These are just some of my final summaries, my opinions about this topic. So I thank you everyone for your time today. Thank you for listening to today's webinar presentation. If you have any questions, feel free to contact me on my email address here. And thank you again, Kathy. If you have anything else you'd like to share with the audience, please do so.
Thank you, Jerrod. I'd just like to duplicate what Jerrod said. I thank you for your participation here. I thank you for your interest in youth fire setting. I have been working with kids who start fires since 1998, and I've seen a lot of them, and I believe that early intervention is the most effective. We've had high success rates with our interventions, less than a 3% recidivism rate after they've gone through a multidisciplinary type intervention, and you all are a part of that, and I thank you for that. I think we can make the world a better place by providing these kids the help that they need. So again, Jerrod, thank you for putting this webinar together on this very important topic, and we'll definitely do some more.
Thank you, Kathy, and thank you, everyone.